Hello, I'm Dr. George Ampat. I'm a consultant orthopedic surgeon and I work in Liverpool. My goal is to help patients with orthopedic problems avoid surgery whenever possible using effective, non-invasive measures, that is, without surgery. One of the most powerful tools we have is exercise. However, many patients are understandably worried about exercise because initially it can cause pain. Unfortunately, pain is often misinterpreted as a sign of harm. As a result, some patients stop exercising altogether. But stopping exercise can actually worsen the condition, leading to more stiffness, weakness, and disability. That's why it's always encouraging to hear from patients who have found relief through consistent, guided exercise. Today, I'm extremely grateful to Jack for sharing his story. Before we hear from him, let me explain his condition and how we managed it together. So let's look at spinal canal stenosis. The spinal canal is a bony tunnel that runs through the spine and houses the spinal cord and the spinal nerves. These nerves exit the canal to reach different parts of the body. Normally, the canal is wide enough to protect the cord and nerves. However, due to degeneration, arthritis, or disc problems, the canal can narrow, compressing the nerves. This condition is called spinal canal stenosis. It often occurs in the neck, the cervical spine, or in the lower back, the lumbar spine, and can cause pain, numbness, or weakness, typically radiating down the arms or legs. So what was Jack's journey? Jack was diagnosed with lumbar spinal canal stenosis, specifically at the L4-5 level. Let us look at his MRI scan. This is the lower end of the spine. This part of the spine is called the lumbar spine. This is the view from the side. The blocks of bone in the front are the vertebral bodies. In between the blocks of bones are the cartilage or discs. In this image, I've outlined the vertebral bodies in blue. The discs or the cartilage are colored green. Behind the vertebral bodies, running like a tube, is a spinal canal, and I have outlined that in yellow color. You can see that the canal is wide throughout except at the very bottom where it narrows down. The narrowing of the spinal canal is called stenosis. This narrowing is at the L4/L5 level, and we can see that it is compressing the nerves. Jack experienced pain in his back that radiated into his hips and legs. Initially, the doctors suspected a problem in the hips, but further evaluation confirmed it was spinal canal stenosis. Jack was not keen on surgery, so we opted to treat him without surgery. So what is the role of exercise? We started Jack on a customized exercise program focused on relieving pressure on the nerves, improving flexibility, and strengthening the muscles that support the spine. He also took some pain medication, which allowed him to perform the exercises comfortably. With time, persistence, and consistency, Jack began to improve. Eventually, he returned to doing the things he loved, especially gardening, which brings him great joy. He even regained enough confidence and mobility to travel to his accommodation in Spain. Now let us hear his story.
Experienced back hip pain for 3-4 years and had a couple of x-rays on the hip, and was only found to have mild arthritis, not worthy of any procedure. And then it slowly worsened until one day 3 years ago I could not walk, and I said to my GP, I can't carry on like this, what we're going to do. I said, I think I ought to see an orthopaedic consultant, and she buzzed me off to see Mr. Ampat, and following a rapid MRI, we found what the MRI scan is showing with my spine, where the problem was being originated. So I then commenced a series of exercises, only mild ones, the sitting on the chair with the knee up 30 times and that sort of thing, with the 1 kilo ankle weights. Then I was persuaded to buy a recumbent bicycle, so I included a recumbent bicycle in my exercises and slowly built that sort of to a 20-minute bicycle ride, and tested myself by trying to do extra half a kilometre every time I sat on the machine. And then I found that gardening, which had been a problem for me 5 years ago, seemed to agree with my problems, and that during the summer I've been able to do gardening, which I hadn't been able to do 3 or 4 years ago when all this problem started. I just could not do the bending and the kneeling. But now I'm able, with pain, but tolerable pain, and of course with pregabalin and morphine medication, then I'm able to cope with that. I can walk. I walk a mile without any problem. I can feel everything is there. I get pains, but I tolerate them. I've slowly now been able to reduce pregabalin from where I started off at 300 twice a day. I'm now down to 100 twice a day, and similar with the morphine. That's only now down to 10 milligram twice per day. But it allows me to be able to carry on with what, at an 85-year-old, one would consider to be a normal sort of existence, and makes life a little bit more tolerable and more enjoyable. So the exercises now, if I feel a problem with my back, I will kick off the exercises and do them without the weights for a couple of days, and I do the pelvic thrusting. That seems to help, and I have some 1 kilo hand weights that I use as well. So it's various exercises. But from being an diagnosed in 1921, I think it was June when I saw Mr. Ampat, 2021, I've slowly made a recovery into a position whereby I'm able to undertake what an 85-year-old would consider a normal sort of existence. I would recommend exercises combined with medication in some sort of form, and gardening, cycling seems to have done the trick as far as I'm concerned. As I'm stood here now, my back is hurting, but I can cope with it. I wouldn't want to do a great deal more gardening today, and you've got to know what level you can work to. I'm quite comfortable with where I am now, and to help me along this Sunday, I'm going to go to Spain for 7 weeks and see what the heat does for me there.
You also heard how he had improved and started gardening. Here's a short video clip of Jack back in his garden, a true testament to the power of movement and perseverance. So what are the key takeaways? Pain with exercise does not always mean harm. It often part of the healing process. Taking painkillers temporarily to support exercise is better than being sedentary. Exercise little but often is the best strategy. Special equipment like a recumbent bike or an exercise bike can make exercise easier and safer for those with spinal canal stenosis. You don't have to do this alone. We have provided links below for specific lower back exercises tailored to spinal canal stenosis. The Otago exercise program, which promotes gentle well-being in older adults, is also provided. I'm an orthopedic surgeon who starts with exercise, education, and self-care to ease joint pain and stiffness. My 3 quick read guides walk you through exactly what to do. Free from pain, strength, balance, and mobility for older adults. Help for hip pain relieves hip pain and hip arthritis. Help for knee pain calms knee pain and knee arthritis. You can find the books on Amazon or on my website, ampat.co.uk. Share with anyone who would benefit. Hit the like and subscribe and drop your questions or success stories below. Stay active and stay strong. So in conclusion, Jack's story proves that with the right approach, non-surgical management of spinal canal stenosis is not only possible, it can be life-changing. Thank you again, Jack, for sharing your journey and inspiring others. If you're dealing with a similar problem, don't give up. There is a way forward, and we are here to help you find it. Thank you so much for listening.